Malala to deliver his statement.
Thank you, Mr. Speaker, sir. The Honourable Speaker, the Honourable Prime Minister, the Honourable Leader of Opposition, the Honourable Cabinet members, Honourable members of this House, August House, and ladies and gentlemen, Nisam Buraminaka, and to you all. Mr. Speaker, sir, 48 days ago in this August House, I delivered my maiden speech as Minister responsible for Health and Medical Services, and highlighted the significant challenges that the Ministry of Health and Medical Services is facing now in the state of its infrastructure. I also highlighted the two key elements essential for our vision for excellence in healthcare, and these are: one, dramatically improved and maintained infrastructure of the 220 medical facilities around Fiji. Secondly, a well-supported, appropriately remunerated and competent healthcare professionals. So our achievements so far, Honourable Speaker, sir, today is my 100th day in Parliament, and I wish to highlight the achievements by the Ministry of Health and Medical Services. Since my maiden speech, the Ministry has worked on reprioritizing funds within the budget and working with the Ministry of Economy to streamline approval processes to reflect these intentions. Indeed, a team led by the head of the Finance and Assets, and including a senior member of the Ministry of Finance, are continuing work to ensure these intentions are reflected in the new budget year. We also embarked on a number of initiatives that have been able to supplement our revamped infrastructure building and maintenance program by calling for a greater community engagement and strengthening the Board of Visitors program. I call on community leaders, youth groups, business houses, faith groups, rural and urban communities, villages, and non-governmental organizations to step forward and lend a helping hand. We then followed this up with the community visitations, where we visited our healthcare workers working in their various health facilities and discussed their challenges with them, as well as encouraging them on the important task they are performing for the people they serve in their communities. We also sat down with the members of the community, including representatives of the local business communities, and encouraged them to assist in the upgrade of their local health care facilities. Honourable Speaker, sir, in reviving the Board of Visitors, at the start of my term in office, 15 of the 22, whereby 68% of divisional, subdivisional, and specialist hospitals, which are at St. Giles and Tamuwatumi hospitals, under the Ministry of Health and Medical Services, did not have an active Board of Visitors. This points to a disconnect that exists between the community and their local health facility, and it needed immediate actions. The Ministry has since instigated an application and appointment process for Board of Visitors members that is fair and transparent. We are pleased with the response we have received so far and anticipate to complete the appointment of Board of Visitors members over the next few weeks. For some of our hospitals, this will be the first time that they will have a Board of Visitors in place. And this is a great step forward in our efforts towards collaboration and community partnership. The Board of Visitors is a legislated body under the Public Hospitals and Dispensaries Act of 2012. Members of the Board of Visitors are appointed by the Minister from the local community. The functions of the Board of Visitors as stated in the Act include the following: the maintenance and repair of the hospital or dispensary under its care and control, the beautification of the hospital or dispensary under its care and control, that the hospital or dispensary under its care or control is well equipped and has the necessary technology to provide higher quality care to patients, assist the Ministry of Health in encouraging good health and prevent communicable and non-communicable diseases. Mr. Speaker, sir, the Board of Visitors are also the voice of the community to the management of the healthcare facility, and they work with the management of the healthcare facility to ensure that the health services is responding effectively to the health needs of the community it serves. Honourable Speaker, sir, while the revival of the Board of Visitors is in progress, please allow me to share a few success stories which depict the level of collaboration and partnership between the health facilities and their local communities. Mr. Speaker, sir, at the Colonial War Memorial Hospital in Suva, the state of Fiji's largest hospital came to light in January when the members of the media took a State of the Nation's infrastructure tours around CWM. After the tour, an infrastructure working group chaired by the hospital's medical superintendent, Dr. Luke Nasendra, and with membership from the hospital's Board of Visitors, hospital administration, the ministry's asset and management unit, and executive support unit was set up. Mr. Speaker, sir, the infrastructure working group have quickly developed processes, trackers, action in response to the list of urgent CWM works and organized for a number of fundraising drives for the hospital infrastructure development. A major fundraising event held at the residence of the British High Commissioner in Fiji, located in Suva, and hosted by the British High Commissioner himself, His Excellency Dr. Brian James Jones, was a success where about $1 million of pledges and commitments have been made towards CWM hospital infrastructure works. Honourable Speaker, sir, for Savu Hospital, it was good to hear from the Subdivisional Medical Officer, Dr. Tale Chiochi, upon our visit. The Savu community have rallied around her to assist with the much-needed infrastructure upgrade work for the hospital. The Ministry wishes to acknowledge Mr. Graham Haynes, the community workers of Noe Island, volunteers, business organizations, and non-governmental organizations, and residents of Savu here and abroad who have pledged donations in cash and kind worth $49,000 towards the much-needed minor repair works and maintenance works for the hospital. The donations are currently being put to good use, as minor works carried out at the hospital will include patching of the roof, replacement of fly screen, water blasting, wiping and painting of the exterior and interior walls and ceiling, replacement of ceiling fans, refurbishment of the hospital notice board. Some community have also assisted in repairing an old power generator at the hospital that has been restored to full function, and the repair of an old ambulance which, once fully functional, will assist to serve the transportation of patients from Tukavesi Health Centre, Matewa Health Centre, and Rambi Health Centre. Honourable Speaker, sir, at the Didia Health Centre in the Lau Group, the Divisional Medical Officer Eastern, Dr. Sylvania Dasi, worked with the Didia Health Centre team to identify and engage local community expertise with carpentry skills to undertake minor infrastructure at the health centre with the material bought by the ministry. The health centre was last renovated 41 years ago in 1982 and needed much work in plumbing, repair of roof, floor and painting. With the support of Tarukua villages and supervised by a single technical person from the ministry, more than 90% of the total labour cost was saved through this health centre community partnership. Honourable Speaker, sir, the example of CWM Hospital, Savu Hospital, Didia Health Centre are impressive and heartwarming. There are more examples, but time is not on my side. However, I am most certain that with more collaboration and teamwork, many more great things can be achieved. Mr. Speaker, sir, I am very pleased to inform the House today that our communities throughout the country have responded in a heartwarming way, showcasing their love and pride for their local health facilities and the resident healthcare workers. Within 10 days of delivering my maiden speech, more than 1,000 people from Suva, as well as other parts of the country, converged at the soon-to-be 100-year-old Colonial War Memorial Hospital for its first clean-up campaign for the year. People from all walks of life joined hand in hand to clean up the aging hospital infrastructure and gave their time and effort for a worthy cause. Unfortunately, Mr. Speaker, sir, I was attending a ministerial forum abroad at the time, but managed to catch a glimpse of the event on the ministry's social media platforms, and I must say I was emotional and at the same time overwhelmed with pride, Mr. Speaker, sir. While I was physically away, my heart and soul yearned to be part of the clean-up campaign back here at home. I'm also informed that the initiative has since snowballed into other hospitals and divisions around the country where community members have stepped up and stepped forward and assisted in the clean-up and beautification of their local health facilities. The late 13-year-old American poet Matty Stepnack once said, and I quote, "Unity in strength when there is teamwork and collaboration. Wonderful things can be achieved." This quote best depicts what transpired at the CWMH clean-up campaign, Mr. Speaker, sir, as well as the effort exhibited in other health care facilities around the country, from the main hospitals and right down to the rural nursing stations. I wish to acknowledge and thank the villages, community leaders, maternity clinic, local businesses, community groups, civil society organizations, religious organizations, and our bilateral and multilateral partners who have supported us and will continue to support us as we move ahead in this endeavor. Mr. Speaker, sir, both improved infrastructure and well-supported healthcare professionals have a significant impact in the quality of care, the morale of staff, but also on health-seeking behavior of all Fijians. If the people's confidence in the Fiji's healthcare system and in the local health facility is high, they are more likely to seek healthcare earlier, which can lead to earlier treatment, recovery, and care, and increased productivity in our communities. Community engagement and partnership is one way we hope to remove our fear of hospitals and improve health-seeking behavior for our people. That is why we are encouraging and engaging members of the community to take ownership of maintaining their health facilities. It is a win-win scenario that promotes Ministry's visions for a healthy population in Fiji, supported by the Ministry's effort to empower Fijians to achieve optimal health and well-being through the delivery of cost-effective, quality and inclusive health services. Mr. Speaker, I wish to touch on human resources for health. One of the Ministry's greatest challenges it is facing now is maintaining its human resource at optimal level for the service we provide. The attrition rate for healthcare workers have been abnormally high over the last 12 to 24 months and facilitated by many pull and push factors that include immigration, the search for greener pastures, education, family welfare, higher salaries, aggressive recruitment techniques by overseas recruitment agencies, and local private hospitals, Mr. Speaker, sir. Mr. Speaker, sir, in the last 12 months, the Ministry has lost some 800 nurses from its workforce, which includes nurses who have moved to the Yaspen hospitals in Lautoka and Ba. The loss is reflective of similar losses noted in the other healthcare countries, such as doctors, pharmacists, laboratory technicians, medical imaging technologies, and others. These losses impact our ability to deliver quality services and also increases the burden of those who remain within the Ministry. This, however, is a global phenomenon that is currently experienced all over the world. In fact, Mr. Speaker, early this week, the United Kingdom placed Zimbabwe in a group of 8 countries in the world that the UK is banned from recruiting health and social workers to safeguard the country's health system. This ban followed the World Health Organization Health Workforce Support and Safeguards List 2023, which highlights countries with dangerously low numbers of healthcare workers. This list exists because many countries, including Fiji, are facing this human resource predicament of healthcare workers' attrition. Honourable Speaker, sir, to address this, the Ministry has been working hard in recruiting healthcare workers through the following. For nurses, through our open recruitment process and open merit recruitment system, a total of 206 nurses were recruited in November 2022, this financial year. A further 80 nurses have been recruited after November 2022, and further 160 registered nurses are expected to be recruited in May this year, followed by another cohort of 44 registered nurses in November, bringing the total number of registered nurses to be recruited to 206 in 2023. 412 registered nurses in the current budget year. Furthermore, 237 graduate nurses will be recruited as intern nurses in June this year. The Ministry will establish 50 new nursing assistants and 50 new nursing aid positions and will be advertised shortly for recruitment to support our nursing teams in our hospitals and healthcare facilities. For doctors, a total of 150 medical interns were recruited in January of this year, while 80 medical officers have been recruited as of today, with the remaining to be recruited as soon as they complete their internship. For oral health practitioners, a total of 205 oral health practitioners, with another 25 to be recruited before the end of the 2022-2023 financial year, which will bring the total of 230. For allied health workers such as dietitians, physiotherapists, pharmacists, medical imaging technologists, laboratory assistants, environment health officers, and biomedical technicians, 558 of the 717 positions have been filled through an ongoing recruitment process, and 87 more posts are processed to be filled during this financial year. Honourable Speaker, in addition to our recruitment efforts, and in recognition that we are losing experienced personnel, the Ministry has also pursued capacity building for its workforce with the support of the central agencies of government and supplemented by our development partners. The in-service training budget of $776,476 for medical officers have ensured that our doctors are upskilled and updated in knowledge, skills and competencies while attaining postgraduate qualifications. For the 2023 academic year, the Australian Government Pacific Scholarship for midwifery sponsored 20 registered nurses, and the Ministry of Health sponsored an additional 20 registered nurses through its in-service training budget. As such, a total of 40 registered nurses is expected to graduate as midwives at the end of the 2023 academic year, and they will be formally recruited in 2024. This is in addition to the Australian Government Department of Foreign Affairs and Trade sponsoring 249 registered nurses in the years of 2019 to 2022 for the postgraduate diploma in midwifery offered by the Fiji National University in Suva and the TC Sangam Institute of Nursing in Lambasa. The Ministry has also negotiated with the World Bank, who sponsored 10 registered nurses to pursue the postgraduate certificate in mental health offered by the Fiji National University for the 2022 academic year. An additional 10 nurses are anticipated to be sponsored in 2023. Similarly, Fred Hollows Foundation is sponsoring 2 nurses for the postgraduate diploma in eye care at the Pacific Eye Institute, in addition to the 44 registered nurses who have been sponsored by the foundations from 2006 to 2022. Honourable Speaker, sir, the Ministry acknowledges the challenging financial situation the nation is in and will continue to work with the central government agencies to advocate for the appropriate remuneration of its healthcare workers for the sterling work that is carried out in all our healthcare facilities. Honourable Speaker, sir, the Ministry has worked hard to improve its ability to effectively engage with its health department partners. The Ministry is establishing development partners coordination to make use of the opportunities provided by the development partners for the delivery of quality health services in the upkeep of health infrastructure. The Ministry has so far held 2 donor partner coordination meetings, attended by a number of important health partners such as Australian DFAT, New Zealand MFAT, JICA, COICA, World Bank, UN offices, representatives, to name a few. These meetings have been positive and have provided a platform for the Ministry to share its plans and visions for the health in Fiji and solicit the support of the health partners towards these programs, Mr. Speaker, sir. Mr. Speaker, sir, in conclusion, as I alluded to earlier, today marks my 100 days as the Minister of Health and Medical Services. A lot has been achieved and a lot more needs to be done. I wish to acknowledge the hardworking staff of the Ministry of Health and Medical Services, who, despite many obstacles before them, continue to work hard and remain passionate and committed to their work. towards the vision of a healthy population in Fiji. Mr. Speaker, sir, before I sit down, to wish you and members of this August House a blessed Easter. Nakwa live, and thank you.